Could a simple saliva test have the power to help prevent cancer? Join us with more insight into this new age of preventative medicine is board-certified oncologist, our friend Dr. Lawrence Piro. Doc, great to have you back.
Thank you. Great to be back. Thank you.
And this is really important for everyone to pay attention to because we've heard of these at-home DNA tests for ancestry, for overall health. But let's talk about DNA testing to prevent cancer?
38% of people in their lifetime will get cancer. So it's on all of our minds, right? And we're all trying to be fit, lose weight, eat well, eat a lot of antioxidants. But if you could know what genes are working against you, then that may help you, providing there's something that you can do about it. And there lies the conundrum, is it's worth testing if you can do something about it, but it may also be worth testing so that you know what you might be passing on to your children, right?
But what I think is so interesting is that we've had the ability to test for genes that predispose to cancer in a clinical setting for a long time. But this new twist is the ability to do it at home, where you may not have the medical knowledge to then interpret your result in a meaningful way. How do you feel about the at-home aspect of this?
Well, there's several features. The at-home piece is possible because it's been made inexpensive. It's really a technological advance of techniques that allow you to screen a large number of genes fairly cost effectively, like in the $150 to $200 range. Prior to that, it may have cost thousands of dollars to screen these genes. And so most people, $1,000 or $2,000 is out of reach, but a few $100 may be within reach. The downside is it's going to be very hard to interpret the information by yourself. And I would advise not to use a test unless the makers of the test provide genetic counseling as a part of it, or you have a doctor who can help you with that, or both.
I think that's great advice. So I'm thinking about this now as a parent. I'm wondering, what is my obligation to them now that these tests are available? What kind of testing should I be pursuing? And then how do I counsel them as to what to expect?
This is really one of the trickiest things in contemporary medicine because it doesn't just involve science and medicine. It involves philosophy, religion, and most important, your psychological structure. God knows we're living in a time period where a lot of people are neurotic, and there's a lot of things to be neurotic about, right? And so you really have to balance who you are as a person. Is information empowerment for you, or is information really a burden for you? Now, it turns out there are cancer genes that give you an increased risk for cancer. So for your own health, it's not a bad idea, especially if you have a family history. I mean, that's the best way to start. And traditionally, if you have a family history of a lot of cancers, of different cancers, then that's a strong reason to test. If you have no family history at all, it doesn't mean you may not have a gene for cancer, but there's less of a reason to test, but you still probably should test. In terms of the children, in general, I think it's nice to know what you're passing on, but especially important in that category would be those genes that give rise to cancers in the childhood years. And there are mainly two of those. One is a mutation in something called P53, that gene, which causes a syndrome called Leaf-Romani, where it's associated with a lot of different cancers and a very, very high risk of cancer. In men, probably about a 73% risk of cancer overall. In women, 100% risk of cancer overall. Pretty significant. And then the other one, which is familial adenomatous polyposis, a gene defect which causes you to have lots of polyps in your colon, like sometimes thousands, and a pretty much 100% chance in your lifetime that you will get colon cancer. And in that case, we remove the colon in advance at a certain time period in their history. So those two are kind of important because those are things that occur in the childhood years. Most of the rest of the things are going to manifest after 18 or 19 or 20, in which the child could be tested themselves depending on the situation.